Thank you, Mr. Chairman, members of the subcommittee. Thank you for inviting me to testify today. My name is Catherine Howard, and I'm from San Francisco. 5 years ago, I was working as a documentary film producer. I wasn't making a lot of money, but I knew that maintaining my health coverage was a big priority. My employer didn't offer coverage, so I went out and I bought myself a private plan. And this plan seemed perfect for a young, healthy person. And it was affordable, only $140 a month. But I had no idea what it would really cost me. I was afraid that I'd get hurt in some minor way, take a fall snowboarding, need a couple of stitches, not living with a life-threatening illness like cancer. After my breast cancer diagnosis in August of 2004, I thought I was covered. I thought, I'm so glad I have insurance. But boy, was I wrong. I discovered that the health plan that I was paying for didn't cover a large part of the cancer care that I needed. And I was on the hook for tens of thousands of dollars in uncovered expenses. I had chosen one of those low premium but high deductible plans. And I had to pay for 30% of all my treatments in the hospital. And it didn't even cover all the services that I needed. I remember staring at this one shot, Neulasta. It cost $2,100 per shot. And the insurance company said, well, that's 30% for you. So right there in that needle is $600. I endured surgery, grueling chemotherapy and radiation regimes that left me too weak to work full time. I was told all along that the key to my recovery was to minimize the stress in my life. And tell me, how do you minimize stress when you owe the hospital more than you've earned in the past year? As the expenses piled up, I was able to pay for some of them. My family helped me. Other things, I just put them on my credit card. And I thought, if I don't die, just deal with this later. Well, I didn't die, and this is later. So I found myself almost $100,000 in debt between the medical expenses and living expenses for while I was sick and couldn't work. By the end of my treatments, I owed $40,000 in medical expenses alone, and I've been paying this off over time, slowly, using payment plans, paying down on those credit cards. But rather than saving money to put a down payment on a house, buy a car, or even have a savings account, I spend $1,800 a month, essentially all the money I have after the basics, to pay towards my debt. I live like a pauper because to pay for the privilege of surviving cancer. People have asked me why I don't just declare medical bankruptcy and wash my hands of all of this. But bankruptcy to me really seemed like a cop-out, and I don't cop out on my commitments. I've made recovering from cancer my mission for the last 5 years. And as I look ahead to the next 5, I would like to see myself out of debt. And I would also like to make sure that this doesn't happen to anyone else. In my work as an innovator at Jump Associates, I know that things can be different. I'm fortunate that my employer offers comprehensive coverage, because if they didn't, if I was back on the private market, I would be totally uninsurable because of my pre-existing condition. I couldn't even afford to buy the same crummy coverage that left me in this financial devastation. The kind of health reforms in the House proposal would have kept me out of this devastating debt and the financial circumstances I'm in now, despite my best efforts. Limiting annual out-of-pocket costs and prohibiting junk policies will save their young people from facing the same circumstances I'm in now. Thank you.
Thank you. Mr. Null, if you'd like to pull that mic up and hit the